So, when we talk about bipolar disorder and the treatment of bipolar disorder, you might hear the term mood stabilizers. And mood stabilizers are a different class of drugs that are designed to even out the highs and the lows. In the previous video, we talked about unipolar mood disorders. So, we're trying to increase serotonin or norepinephrine, or sometimes even uh, dopamine with the MAOIs, and that's the focus. We're trying to elevate it. Whereas with bipolar medication, we're trying to stabilize one's mood. So we're trying to even out the highs and the lows. So you might hear mood stabilizers referred to as anti-bipolar medication, and these are basically drugs that treat bipolar. Now, lithium was one of the earliest treatments of bipolar disorder, and we discovered by accident that lithium worked. So, how did that happen? During the war, there was reduced sodium chloride. So, sodium chloride is basically table salt, right? So, they had to find another salt substitute during the war, and they discovered lithium salts. So this is a mineral-based salt that's effective at treating bipolar, and people who struggle to function when using lithium salts tended to do pretty good, and they were shocked. And then they did studies, and sure enough, in clinical trials, lithium worked. So lithium became one of the earliest treatments of bipolar, and it remains a very common medication. But we do have to be careful when prescribing lithium not to have something called lithium poisoning. So that would be a buildup of lithium in the system. So if you're prescribing lithium, you have to do blood panels to make sure that your blood levels are good. There are other medications, though, that work. Anti-seizure medications, so what we call neuroleptics, right? Things like Tegretol work for bipolar disorder. Now, it is not what the medication was developed for, but we see it works for mood stabilization purposes. And then some antipsychotic medications work for bipolar disorder. Now, I think it's important to understand that the reason why antipsychotic medication are called antipsychotics was because they were developed to treat psychotic disorders like schizophrenia. But that doesn't mean that if a person is prescribed an antipsychotic, they have psychosis. That's not true. So, for example, a person with bipolar disorder might be prescribed something like Clozaril, and that works. That works as an effective treatment of bipolar disorder, even though it was originally designed to treat psychosis. So when it comes to mood stabilization, we have our traditional anti-bipolar medication, then we have neuroleptics or anti-seizure medications, and we have atypical antipsychotics. But when messing with the neurotransmitters, we have to be very, very careful that the levels don't get too high or too low, especially with lithium, because if the levels are too low, then the treatment's not going to work. But the higher you raise the dose, the greater the risk of lithium poisoning, which was something I talked to you about. So what else is there? So in addition to medication, there is adjunctive psychotherapy. What do I mean by adjunctive? in addition or in conjunction, added onto. Medication in isolation is oftentimes ineffective. I would say therapy in isolation is oftentimes ineffective. It's the combination of therapy plus medication that works best for bipolar disorder. So, what are some of the issues that we're going to treat in therapy? Medication management. That's the number one, because if medication is necessary, we have to get our buy-in of the client, because the client may say, I don't need medication, and it's going to cause a slower recovery time. Right? It's going to take longer to get better. So we might talk about the importance of medication. We might talk about the consequence of irregular medication, so taking it some days and not, and the consequences of stopping medication altogether. So medication management is something we talk about right away. Social skills. Social skills, you might think, well, what's there? Well, when a person is in a manic state, they run the risk of becoming more irritated, more confrontational, and it can affect some of their social relationships. So we might target some social skills. Relationship building. Again, interpersonal conflict is increased with individuals with bipolar. So we're going to try and work on relationships with romantic partners, children, family, things of that nature. And then some of the social deficits that come from bipolar, such as legal issues, occupational problems, educational problems, whatever facet of life that is damaged or there's a dysfunction in because of the disorder, we're going to target that too. And that is a very, very comprehensive overview of the treatments. So let me stop there, and we'll stop